Thank you very much, and thank you everyone for being here today. As Minister for Mental Health and Older People, I am acutely aware of the urgent need to address the shortage of care workers in Ireland. My budget this year is for 666 million to deliver home care. My budget for next year is 700 million. Today, as we stand here, 56,000 people will receive home care, but unfortunately there are approximately 6,200 people on a waiting list today who won't receive home care. Not because we can't fund it, but because we don't have the healthcare workers to deliver those vital supports. So earlier in the year, we put in place a strategic workforce advisory group working with my team in the department to look at this particular issue and to see what could we do to make home care a viable career option, to encourage more people to go back into home care. And there were 16 recommendations. And I have endorsed every one of the recommendations, so I'll just give you 3 of the recommendations which I think are really important. One of the recommendations that anybody working in home care would be paid a minimum of the living wage, which is $12.90 at the moment. The second one is that anybody working in home care, if they travel, they would be eligible for travel expenses. And thirdly, in relation to employment permits, and I'm now going to hand over to my colleague, Minister English, in relation to that piece.
Thanks, Minister. And again, I also want to agree and join Minister Mary Butler today in recognising the importance and welcome the launch of the report today by the Strategic Workforce Advisory Group focused on the roles of home carers and nursing home healthcare assistants in Ireland. I was delighted that Minister Mary Butler took the initiative last March to establish this working group and to bring all the various departments and agencies together to focus in on this, because it's an area of great concern for all of us who are working with individuals who can't get the care they need in their home as well. And it's raised quite a lot with myself and Mary, certainly in the floor of the Dáil and in debates as well. I think Minister Mary Butler, on behalf of the Taoiseach, took on to do this work and to bring all our departments together, which has us here today as well. My department has been a member of that group, and we continue to work with the Department of Health and others to address the recruitment challenges faced by the nursing home and home care sectors in Ireland. As outlined by Minister Mary Butler, the report presents 16 recommendations which, when actioned, will help address the labour market challenges into the future, which help attract and retain workers we need to look after our ageing population. It's important that as we get older that there are care choices that will allow people to age with dignity and respect, and also in place when they want. And it's about having that choice and that option. And a lot of the work that Mary is doing with the Department of Health is around giving people the option and the choice and the access to those services as well. And a key part of that is to make sure we have the personnel available to be able to provide that care. The report addresses the challenges of recruitment, pay and conditions of employment, barriers to employment, training and professional development, sectoral reform, and importantly the monitoring and implementation of the plan. For us as a department, and for our part, one of the key recommendations that Mary's referenced is on the eligibility for employment permits for the home care sector, which falls under our area of responsibility as a department. The HSA data has indicated that Mary's referenced that over 5,000 people were waiting for home care support from the HSE services last year because no care workers were available to provide this, and this is a situation that we cannot allow to continue. The General Employment Permit Framework for home support workers will replicate those currently in place for healthcare assistants in nursing homes, with an upper limit of 1,000 General Employment Permits to be issued. It will include a stipulation for a minimum 2-year contract to be offered, a minimum salary of €27,000 per annum based on a 30-hour week and based on the recommendations of the report, and a minimum continuous shift length per working day of 4 hours. A key part of our work here, and we recognise the recommendations in the report recommended the access to a permit. That's certainly part of the short-term solution, but we're looking forward to working with Mary and all the other stakeholders in the years ahead that we can try to address this from within available talent within the country who might be, because in front of this recommendation of these reports, might be in a better position to take up a career as a carer or as a home carer, working with those in their own home or in a nursing home setting as well. So I look forward to working across the department to achieve that in the long run as well.
I'm delighted that I have been able to work with Minister English and his department in relation to employment permits. We know that these permits outside the EU have actually worked, because we've seen over 2,500 people come into the nursing home sector on the back of these permits being issued. And I suppose, you know, it's very disappointing for me as Minister when I do have the budget to make sure that everybody who needs home care, people want to age well at home, they want to have the correct wraparound supports. And, you know, we are really challenged in this regard. 75% of people who deliver home care work part-time. And we were hopeful that maybe we would be able to fill these advertisements from our own workforce, but unfortunately that wasn't possible, and we have waited we have looked at this over the last 12 months, but I suppose I'm just very conscious of the fact that, at one stage we did have 9,000 people waiting for home care. We brought it down to 4,000 people, but the numbers are climbing back up again as we face into the winter after COVID. A lot of vulnerable people want to stay at home, but they need these vital wraparound supports. And that's why I feel, working with Minister English and his department, that I do believe that these employment permits will make a huge difference. And even if we manage to get 500 or 600 people to come into the country to work as home carers, it will have a significant effect on the waiting list.
I may just add to that, I want to give the commitment today that as a department we'll make sure now to be able to move at pace to make sure that these permits can be available or open for application this side of Christmas.
Thank you very much for that. So if there's any questions.
Hi, Mr. Rowland from the Irish Times. How are you going to ensure that these 1,000, is it 1,000 workers?
1,000
Yeah,
initially.
how are you going to ensure that they're going to be paid properly, and what kind of salaries can they expect?
Okay, so two of the recommendations from the SWAG report is that all home care workers, even those that are employed privately through the tender from the HSE, will receive a minimum of $12.90 an hour, which is the living wage, and it will increase with the living wage. We are aware, for example, that some healthcare workers, home care workers, HCWs, might only receive $10.50, $11.50 an hour. We hear of that. Some workers don't get any. They don't get any travel allowance, and especially if you're living in rural areas, a lot of the service you provide, you can be travelling from house to house to deliver that service. But in relation to, we know, for example, that we will be able to deliver this because previous workers that have come in, the conditions are very, very clear in relation to employment permits. You have to pay $27,000 per year. You have to guarantee 2 years' work, and you have to make sure that they have 4 hours continuous work every day. So, Minister, do you want to comment further on that?
Yeah, we're very strict with the permit process in the department, and again, the releasing of 1,000 permits for this sector is based on a lot of evidence and work gathered for the last 18 months. The sector for a long period of time have been requesting this as one of the options, and we would have worked with them to make sure that the terms and conditions that Mary has referenced were included in that, because it's very, very important that the permits aren't the only solution, but they're part of a solution as well. When permits are granted, there's conditions attached to them. In this case, in relation to the two-year rule, the wage of 27,000, the 30-hour week commitment, and also the minimum 4-hour shifts, because they're all concerns. In the past, a lot of the jobs on offer here might have been part-time. We want to make sure that they're a good quality job that we can track and we can monitor, and the full arms of the state from the industrial relations agencies will and do track and do monitor the situation when permits are granted as well. We've just left committee for the last 3 hours where we're discussing changes to the permit legislation. And a lot of the ask there is that we do strengthen the scrutiny and the follow-up and the evidence behind these permits as well. But we're quite confident that generally permits have led to an improvement of conditions because they are well monitored and they're in the contract of employment as well.
If I could just say, another area that we are looking at internally as well to address the current situation is that there are many care workers out there that may have worked previously as a care worker, but unfortunately, because of some of their social welfare supports inhibit them from taking up this work again. So we're working closely with the Department of Social Welfare. I've asked them to report back to me within 6 months in relation to see are there any alternatives we can do. So say, for example, a person might be prepared to do 10, 12 or 14 hours a week, but we don't want them to lose their medical card, for example. Or, sometimes if you're delivering care in the mornings or in the evenings, you might work 3 hours a day and they can't sign on for the other day. So we're trying to think outside the box to see what can we do to support people who were previously healthcare workers working in Ireland back into the workforce as well. So we're looking internally as well as going outside the EU for the employment permits.
And I suppose it's general, it's fair to say that in many of the sectors that's similar to this, where there's a lot of pressure to find people you need, be it in retail, be it in the home care sector, many other areas as well. It's around the terms and conditions, and a lot of the effort of this report was to lead on to this will become a career of choice. And with good terms and conditions, good training, good qualifications, I think people will realise and more people will turn to this as a career as well, because there is a massive need, and there's increasing need, because our population, the figures are going to show that there's a lot more people will need care in the years to come as well, and we want to get ahead of this as a country. So that means making sure it's an attractive area to develop a career as a carer, and that's something I think this report will lead on to that.
Thank you.